Imagine waking up one morning and feeling a dull ache in your bones, just an annoying pain that makes you think, did I sleep wrong? But over time, the pain gets sharper, almost as if something is growing inside, pressing against your bones. Days turn into weeks, and when you finally decide to see a doctor, you're met with news you never expected. You're told you have Ewing sarcoma, a rare type of cancer, and it's spreading. 1. What is Ewing sarcoma? Ewing sarcoma is a type of cancer that originates in the bones or soft tissues. It's an aggressive cancer that mostly affects older children and young adults, but can impact people of any age. Unlike many cancers, Ewing sarcoma often starts in the bone, though it sometimes begins in soft tissues near bones. Once the tumor begins to grow, it can create pain, swelling, and even cause the bone to fracture due to weakness. When Ewing sarcoma metastasizes, or spreads, it can become a much more challenging battle. It often spreads to the lungs, other bones, or bone marrow, which makes treating it more complicated. This spread is what we call metastatic Ewing sarcoma. 2. Recognizing the symptoms of Ewing sarcoma. The signs of Ewing sarcoma might not be clear at first, but recognizing symptoms early can make a big difference. Some common signs of Ewing sarcoma include persistent pain in bones or soft tissues, sometimes leading to swelling, tenderness around the affected area, fatigue and weakness, fever or unexplained weight loss. In advanced cases, fractures due to weakened bones. In cases of metastatic Ewing sarcoma, symptoms can extend beyond these, depending on where the cancer has spread. For example, if it spread to the lungs, it might cause difficulty breathing or chronic coughing. 3. How is metastatic Ewing sarcoma diagnosed? To confirm the presence of Ewing sarcoma, especially if it has metastasized, healthcare professionals use a series of tests. Imaging tests, X-rays, MRI, and CT scans help detect tumors in bones or soft tissues and see if the cancer has spread to other areas. Biopsy, a small piece of the tumor is examined under a microscope to confirm the type of cancer. Bone marrow aspirate, since Ewing sarcoma can spread to the bone marrow, this test helps check for cancer cells in the marrow. Each of these tests plays a role in identifying the cancer, determining its stage, and deciding on a treatment plan. 4. Treatment options, the fight begins. Treating metastatic Ewing sarcoma often requires a multi-pronged approach. Because the cancer has spread, doctors use treatments designed to target not only the primary tumor, but also cancer cells throughout the body. Here are the most common treatment methods. Chemotherapy. This is typically the first step, where strong medications are used to kill cancer cells or stop them from dividing. Chemotherapy can also help shrink the tumor to make other treatments more effective. Radiation therapy. Radiation works by targeting the tumor with high-energy beams to destroy cancer cells. It's often used when the tumor can't be removed surgically or as an additional measure after surgery. Surgery. After chemotherapy or radiation, surgery may be necessary to remove any remaining cancerous tissue. This step can sometimes be life-saving, especially in advanced stages. Clinical trials. For some patients, clinical trials offer hope. New drugs and treatments are always being studied, and joining a clinical trial can provide access to cutting-edge therapies that may be more effective than standard treatments. These treatments are powerful, but they also take a toll on the body. With metastatic Ewing sarcoma, aggressive treatments are often necessary, meaning side effects can be challenging. 5. What about survival rates and the outlook? Let's be real, a metastatic diagnosis can feel like a heavy burden. According to statistics, the 5-year survival rate for metastatic Ewing sarcoma patients between 2010 and 2016 was around 39%. This might sound disheartening, but it's crucial to remember that this data doesn't reflect the latest advancements. Treatments are constantly improving, and for many, this increases hope. Additionally, factors like age, overall health, and the specific location of metastasis can all impact survival rates. Children often have a slightly better outlook, possibly due to their ability to handle higher doses of chemotherapy. And while adults with metastatic Ewing sarcoma face a tougher battle, Aggressive treatments and continuous follow-up care can significantly improve their chances. 6. Addressing the big question, can it be cured? For many facing this diagnosis, the ultimate question is, can metastatic Ewing sarcoma be cured? The answer is complex. While early-stage Ewing sarcoma has higher survival rates, metastatic cases are more challenging. However, some patients do achieve long-term remission with a combination of chemotherapy, surgery, and radiation. There is also the possibility of recurrence, meaning the cancer can come back even after successful treatment. The chance of recurrence is higher with metastatic Ewing sarcoma, particularly within the first 2 years. However, the longer someone remains cancer-free, the better their outlook. Aggressive treatment, careful monitoring, and lifestyle adjustments can all help improve outcomes, but the path may be filled with ups and downs. It's a journey that requires resilience and a strong support system. 7. The power of research and the role of clinical trials. One key factor in treating metastatic Ewing sarcoma is the ongoing research and development of new treatments. Clinical trials are a significant part of this. They offer hope by testing new drugs and treatment strategies that aren't yet available to the public. While not all patients will qualify, participating in a trial can sometimes open doors to treatments that may work better than current options. Additionally, research is always uncovering more about Ewing sarcoma and other cancers. Every study, every experiment, brings new insights that can lead to better survival rates, more effective treatments, and hopefully, a cure one day. By supporting cancer research, either through participation or advocacy, we can help create a future where metastatic Ewing sarcoma becomes a treatable, even curable, condition. 8. Frequently asked questions. Can you survive metastatic Ewing sarcoma? Yes, it's possible, but survival rates vary. With treatment, some patients achieve long-term remission. While there is always a risk of recurrence, many are able to manage the disease and maintain a good quality of life. Is there hope for stage 4 Ewing sarcoma? Yes. While stage 4 Ewing sarcoma is challenging to treat, aggressive therapies and surgical options can sometimes remove both the primary and metastatic tumors. With continuous research, the outlook for late-stage Ewing sarcoma continues to improve. 9. Finding strength in the journey. Facing metastatic Ewing sarcoma is not an easy road, but you don't have to walk it alone. Talking openly with healthcare providers, staying informed about the latest treatments, and seeking support from loved ones can all help navigate this difficult journey. This fight requires more than just medical treatment. It takes courage, support, and a commitment to keep going, even when the path feels steep. And while the statistics may sometimes feel overwhelming, it's important to remember that every person's experience with cancer is unique. Research is advancing, and hope is very much alive.